International Conference on Hospital Administration, presented by Rianti Merviana Erungan with Dr. Gigi Wahyu Sulistiadi Mars. We are from Hospital Administration, Faculty of Public Health, University of Indonesia. Right now we are talking about COVID-19 pandemic for this research. The title is Preparedness of the Bhakti Wiratantama Army Hospital before and during the COVID-19 outbreak. Coronavirus is one of the large family of viruses. On March 11, 2020, WHO established COVID-19 as a pandemic. To protect yourself against coronavirus, you have to wash your hands, avoid close contact, cover nose and mouth, avoid shaking hands, wearing protective mask, avoid public place. And for this research, aims to analyze, to assess the level of preparedness of the Bhakti Wiratantama Army Hospital in facing the COVID-19 outbreak. For this study, for this research, we use case study research, case study method, and then quantitative and qualitative approach. The respondent selection, we using purposive sampling method. Purposive sampling helps to reduce the variation in data to get focused results. The process of organizing data in this research. The first, we use literature study from the past research, and then health regulatory or laws in Indonesia. The instruments of this research based on hospital readiness from WHO about incident management system, such as communication, continuity of essential health services and patient care, search capacity, human resource, logistic and management of supplies, including pharmaceuticals, essential support services, infection prevention and control, case management, surveillance, early warning and monitoring, and the last is laboratory services. The second, we use in-depth interview. And then for the results of this study showed Bhakti Wiratantama was unprepared for the COVID-19 pandemic before March 2020. It happened because Bhakti Wiratantama Army Hospital wasn't designed as an infection disease hospital. During pandemic on March to June is sufficient for maximum capacity 32 patients. And then the hospital readiness results during pandemic on March to June 2020 is communication 50.54%, continuity of essential health services and patient care is 100%, the search capacity 57.02%, the human resources 56.40%, for logistic and management of supplies, including pharmaceuticals, 51.51%, for the surveillance, early warning and monitoring, 69.07%, for the case management, 59.88%, and then for infection prevention and control is 58.96%, for the essential support services, 95.23%, for the laboratory is 53.85%. Our suggestion, Bhakti Wiratantama hospitals needs to plan for the additional negative pressure isolation rooms To anticipate the overflow beds in case of a spike in hospitalizations caused by the C-19, and then do prepare for HR strategy plans such as succession planning, aggregate planning, absence management, retention, minimize employee turnover, recruitment or selection health personnel, included volunteers from the community in case there is a transmission of C-19 between health personnel inside the hospital. In addition, the Indonesian government should be focused to slow down the community transmission, then strictly do implementation on C-19 protocol or regulation such as lock down some area of Indonesia, especially the high risk or red zone of C-19 area, so it will do not spread easily to the community. Thank you.